We know that 1.1 million people are living with HIV in the United States. We know that 56,000 people are infected every year. Every 9.5 minutes, someone is infected with HIV.
And because the number of people living with HIV has gone up over that years, that means we're driving down infection rates slightly, but not fast enough. We're keeping pace when we should be gaining ground. And that's why the President thought it was so important for the first ever comprehensive national HIV/AIDS strategy to be put together. After a year of information gathering and analysis, of conversation with healthcare providers and persons living with HIV and AIDS, with researchers and health workers, with activists and community leaders and academicians, we're announcing a plan today that has an ambitious vision. The strategy is focused on 3 concrete goals: reducing new HIV infections.
To reduce new HIV infections, we believe we need to do 3 things. We need to intensify our prevention efforts in communities where HIV is most heavily concentrated. We need to expand targeted efforts to prevent HIV infection using a combination, and that's the key word, a combination of effective evidence-based approaches. And third, we need to educate all Americans about the threat of HIV and how to prevent it.
Increasing access of care and optimizing health outcomes for Americans with HIV/AIDS.
Now, to increase access to care and improve health outcomes, we also have 3 key steps we've identified. Building on the Affordable Care Act, the landmark health reform law that's going to do so much to improve access to health care for millions of Americans, but including people with HIV. So building on this, we believe we need to establish a seamless system to immediately link people with HIV into continuous coordinated quality care as soon as they're diagnosed with HIV. That we need to take deliberate steps to increase the number and diversity of available providers of clinical care and related services for people with HIV. And third, we need to support people with HIV who have co-occurring health conditions and who are challenged in meeting their basic needs.
And reducing HIV-related health disparities.
To reduce HIV-related disparities, we believe that we need to work to reduce HIV-related mortality in communities at high risk for HIV infection. We believe we need to adopt community-level approaches to reduce HIV infection in high-risk communities. And we need to reduce stigma and discrimination against people living with HIV.
The goals aren't necessarily new, but the strategy for achieving them is new.
The message is clear. We need the entire country involved, and this epidemic affects everyone. You don't have to be infected to be affected by this virus.